Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. The dog days of summer are just around the corner, and all the local creatures are out and active, including ticks, which are the carriers of several dangerous diseases. Joining us to discuss tick fever is Dr. Stillwell, an infectious disease specialist. Thank you for joining us, Dr. Stillwell. We appreciate it.
Thank you for having me.
So tell us, what is tick fever and what kind of tick-borne diseases are here in northwest Arkansas?
Well, tick fever is a syndrome that people get after being infected with one of several different syndromes from ticks. And
I'm sorry, go ahead.
well, if we want to talk about the different syndromes, around here, certainly our most common one is ehrlichiosis.
Okay.
But we also have Rocky Mountain spotted fever, tularemia, Q fever. We even have a little bit of Lyme disease in the area, but it's pretty uncommon.
And why is this something that we should be concerned about?
Well, people can get very ill from tick fever. Frequently within a few days, a week or so after the tick bite, they can develop not just uncomfortable symptoms, fevers, muscle aches, headaches, and the like. They can develop multiple system problems. We even have many people we admit to the hospital with this each year around here.
What are the most common signs and symptoms that you see with people that may be coming down with Lyme disease or tick fever?
Well, with any of the tick fevers, the big three are fever, headache, and muscle aches, very similar to what you'll get during flu season with viral syndromes. A lot of people think, oh, I don't have a skin rash, I can't have tick fever. Well, with many of our tick fevers, you frequently don't get a rash. And even with Rocky Mountain spotted fever, you only get a rash about 80% of the time.
I see. So is it commonly mistaken sometimes for the flu? Or because we can see tick fever, Lyme disease any time of the year versus usually with the flu, we'll see it in the winter.
Right, it frequently is. Around here, things get warm enough for the ticks to get out, get about. People cut wood in the winter, and we'll see tick fevers even in December, January, and February each year.
So fever, headache, muscle aches. What if someone ignores these symptoms, doesn't go and seek treatment when there could be an underlying tick-borne illness? What could happen?
Well, for the most part, most people probably do get better on their own, and we probably, as healthcare workers, see only the tip of the iceberg. But untreated, people can get more and more ill. They can develop multi-system failure, liver failure, kidney failure, severe rashes. We'll frequently see them come in with mental status changes and delirious. And
do you see this, is it more common in children than adults, and can it be more serious in children?
Well, it's always the extremes of age that do the worst. The very elderly and the very young with any disease often do worse. And very young children can get sick much quicker sometimes than healthy middle-aged people.
So for those who, for example, they find a tick on their body and they pull it out, what's the next step that they should do?
Well, you want to clean the area. You want to really try to make sure you get the tick off and really kind of get the forceps down and get the head out, because a lot of what we see are secondary staph infections from where the ticks irritated them. And you want to clean it off and just be watching and kind of tell other family members, remind me in another 4, 5, 6 days if I'm feeling bad and looking bad, maybe I might have tick fever.
And what are some of the treatments that are available, Dr. Stillwell?
Well, what you'll see most of the physicians do is treat with doxycycline. And that's the one drug that hits all of the tick fevers. And there, for some of the other ones, such as Lyme or other options, but you'll usually see doxycycline or tetracycline given right up front. And
that can also sometimes help treat secondary staph infection, is that right?
That's right. It'll miss some of the streps, but for even a lot of our resistant staphs these days, the doxycycline will hit it.
What are some of the diagnostic tests available to check for tick fever, Lyme disease, that sort of thing?
One of our real problems with the tick fevers is generally when the patients present with their symptoms, the tests for the tick fevers are negative. We do have some rapid tests called PCRs that take several days to come back, but the traditional antibody tests often don't turn positive until people are 2, 3, 4 weeks into the illness. Frequently, they're all better by the time the tests come back. So they are blood tests, but they're not always reliable right up front. And that's why you've just always got to have it in the back of your mind when you're treating patients in this part of the country. You know, this might be a viral syndrome, but might it be tick fever too? And maybe should we give them a round of doxycycline with the other treatments?
So sometimes that prophylactic treatment, if you have that hunch, should be treated just to prevent some of the long-term complications.
Right. With any of these, if you treat them early, frequently the symptoms will abate very quickly. The further you are into the course of the illness, when you start treatment, the less well you're going to do with it.
What about some of the long-term consequences, not necessarily organ failure, but I understand arthritis and weakness and fatigue. Those are some qualities of life factors that people can actually have if they don't seek treatment, or even if they have, they can have that lingering effect. Does that sound about right to you?
Yeah, they really can. Even with the usual tick fevers, with Ehrlichia and Rocky Mountain spotted fever, people often feel really kind of bad for the next several weeks, sometimes even a few months. With Lyme disease, also with tularemia, there's some very late consequences, and this can be involvement of the nervous system. It can be inflammatory arthritis that looks just like rheumatoid arthritis. So again, early treatment's your best way to go.
What would you recommend are some steps to try to avoid these tick-borne illnesses and tick fever?
Well, the best way is to try to stay away from ticks, which you can't do in this part of the country. They're everywhere. But whenever you're outdoors doing work, camping, hiking, covering up as much as you can, long sleeve, long pants when you can, using DEET as a repellent sometimes holds the ticks back somewhat. But the most important thing is, at the end of the day when you get home, check yourself everywhere, because with certain tick-borne diseases, the duration the tick's been present determines whether or not they really come down with the disease later on.
Sure. And it's important to check every crack and corner. They can be hiding behind an ear or in an underarm, that sort of place, right?
Yeah, and one other thing is a lot of people are always pulling ticks off their dogs and their cats. You really ought to be using rubber gloves, because people will pull them, the ticks will open up, blood will get on their finger and their cuticles, and that is a way of getting tick fever.
And even some people who have animals that are indoor and outdoor pets and allow the pets to sleep in the beds with them or on the couches, they can transmit that way as well. A lot of people don't realize that, even though they are our loved ones.
You're absolutely right.
How many cases of Lyme disease are reported here in this area?
Well, it's very uncommon. I don't know the exact numbers year to year. Our problem is it's probably overestimated locally because of the tests. A lot of our tests are false positive right up front. But we don't tend to have the main tick vector that carries Lyme around here. It's thought that maybe some of the other ticks, like the Lone Star tick, every once in a while can carry it. But the Ixodes tick, the main vector of Lyme, is not very prevalent around here. So as the tick-borne diseases go, that's probably one of the least common ones we ever see.
If someone is tested for Lyme disease early and it shows up negative, do you recommend for them to be tested again in 6 weeks or 8 weeks when the titers can show up as positive?
Well, I think it's a good idea, because Lyme is one of these diseases that can have late outcomes that are adverse, even months or years later. And when you know whether or not you really had Lyme versus not having Lyme, makes a difference on how you'll be watched and what you worry about later on.
What is post-Lyme syndrome?
Post-Lyme syndrome is a disease where people have fatigue and muscle aches and joint aches, and sometimes they'll even have some problems with concentration. And it's not really active Lyme disease anymore. It's even after the treated time, and it's a very frustrating disease. In the old days, people used to treat patients over and over and over, and for months and months and months. And now the studies show that antibiotic treatment, at least for post-Lyme syndrome, really doesn't do anything beneficial and probably causes some harm.
So really just supportive care at that point?
That's exactly
So
right.
always important to take the proper safety precautions and steps when you're outdoors, hiking and that sort of thing. Where can patients go to get more information, Dr. Stillwell?
Oh, probably it's all over the internet right now. I mean, any of your healthcare workers around here, your physicians, your nurse practitioners, PAs, know a lot about tick fever, because we live in the tick capital of the world.
Absolutely.
And so everybody's healthcare workers can always inform them a little bit more.
Very good. Well, thank you so much for joining us today.
Thank you for having me.
All right. Stay tuned. Family Health Today will return in just a moment.